Welcome to the GEMS Report, brought to you by Clarence Events, Fire and Rescue Group, and the Journal of Emergency Medical Services. My name is Ted Lee, and I'm the editor-in-chief of GEMS Magazine. Along with Jeff Frankel, our managing editor, we will be bringing you subject matter experts and industry leaders in all things pre-hospital medicine. And today we have Luke Estes from Prisma Health. He is the manager of their mobile integrated health program. Thank you for joining me today.
No, I appreciate the opportunity. Thank you.
So why don't we get into your background? Tell us a little bit about yourself and kind of your progression through EMS and then into the mobile integrated health realm.
Yeah, so I was born and raised in central Missouri, where I started my fire EMS career with an Explorer program with Columbia Fire Department in Columbia, Missouri. Age 14, started getting involved with the fire department, doing through the Boy Scouts, the Explorer program. At 18, I joined Boone County Fire Protection District, was able to be an EMT and firefighter for them, and then kind of worked my way through paramedic school, through Boone Hospital there in Columbia, and then eventually making my way down to South Carolina in 2006. Where I started with Richland County EMS, took a brief hiatus to Mission Hospital in Asheville as a supervisor there, and then came to Prisma in 2020, right in the middle of COVID, to help with the blood pilot. So South Carolina was issued a component therapy blood program, and they needed a data research and coordinator. So I took that spot. Once the blood pilot came off of pilot and was available to all services in South Carolina, we looked at a mobile integrated healthcare program or a community paramedic program, which is where I sit now. And we've been about 4 years in the making with me being here at the mobile integrated health at Prisma Health.
And where are you located exactly?
We're in Greenville, South Carolina, but our program has a footprint all the way from Oconee County to Sumter County in South Carolina.
So for those who don't know South Carolina and the counties, about how big a span is that?
Oh, man. That is probably just about 12 counties. So between Oconee all the way to Sumter, about 12 counties. Probably a fourth of the state of South Carolina.
Yeah. So this is a big thing. So again, for people who aren't in the South Carolina area or that area, who is Prisma Health and how are they involved with the mobile integrated health aspect of it?
So Prisma Health is it's a healthcare organization in Greenville and in Columbia. They hold 2 level 1 trauma centers, some stroke centers in Greenville and Columbia. They are one of the largest healthcare organizations in South Carolina today.
Okay. So with the mobile integrated health aspect of it, and you mentioned community paramedic, is there a difference in South Carolina between the two, or are they kind of the same?
Yeah, they're one and the same, kind of interchangeable between community paramedic and mobile integrated health. We chose mobile integrated health because it's kind of an umbrella term for us. Under that umbrella of mobile integrated health, we have a really robust community paramedic program, but we also have other programs that focus on hepatitis C virus, that focus on treatment in place for skilled nursing facilities, that focus on infectious diseases and CHF. So there really is no difference. We just have an umbrella term that is mobile integrated health that our community paramedic group falls underneath.
Okay. Well, why don't we lean into that community paramedic group first, and then if we have time, we could talk about the other one. So, what kind of programs are under your umbrella of community paramedic? What are they doing?
Yeah. So our community paramedics follow a readmission program, right? So the hospital identifies folks who are at risk of being readmitted. They identify folks that may have social determinants of health. Those social determinants of health can cause readmission and do cause problems with accessing the healthcare system. So my folks basically are the facilitators, right? So they show up, they say, hey, what determinants of health are causing you to re-access or to engage with the healthcare system, and how do we address those? So do we need to try to find you a primary care provider? Do we need to try to find you transportation? Do we need to try to find you financial assistance with your prescription medications? Do we need to try to change your prescription medications to something that you can more easily afford? So it's really, the goal is just go connect with the patient, find out what the needs of the patient are, and then how can the community paramedic, along with the healthcare system, help break down those barriers.
Right. So this really started from the classic need of to reduce readmissions during the time frame, and then it expanded from there.
Absolutely. So it started with readmissions, but then has just became this blossom of what else can community paramedics do, or what else can MIH do. And at a healthcare system level, I think our team is kind of integrated in everything they do, right? So, we have a problem in A. Well, what can the community paramedics do, right? It kind of becomes a double-edged sword for us, as we've said, yeah, we'd love to help, we want to do things, and then here comes all these needs, and now we have to fund it, now we have to staff it, now we have to figure out how we're going to do it. And the really exciting thing is that, as paramedics, we're used to kind of just being outside the box and thinking outside the box. And so, okay, here's a challenge. What's the problem? Here's our solution, or here's what we think we can do.
Right. Well, it always starts with, there's a curtain, and then somebody has to peek behind the curtain and then realize, oh, okay, this is all the finer points of what has to be done for that. So how long has this program been in place? You mentioned earlier that you came over for a blood program and then transitioned.
So I came about 4 years ago, but the original program started with one person. His name's Scott Gosnell. In about 2019 or so. 2019, Scott kind of took a risk. He was a paramedic on a truck, and they said, we're going to start this community paramedic program. And Scott said, oh, okay. What am I going to do? And they said, well, we don't really know. We just need you to come off the truck, get a QRV, and go forth and do. Right. So Scott laid down the foundation in which we build today. He is the guy in which he's my supervisor now for mobile integrated health, but he's the guy in which took that risk and said, we're not sure what we're going to do with it, but we need you to come off the truck and we need you to be a community paramedic. And so he started really laying the foundation, working those relationships, which are really important at MIH, is to have solid relationships with as many people as you possibly can. But he started making those relationships, and we build upon what he set off in 2019.
Yeah. Well, and that's the beauty of it. And sometimes the pain of it is that a lot of these programs are uniquely tailored to what is needed in any setting or in any municipality or jurisdiction. So what's happening in Greenville, it might be very similar to what's happening in Missouri, like you mentioned where you came from, Missouri, but it's not going to be exactly the same. It has to be tailored and tweaked to the resources that you have and the partnerships, like you mentioned, that you have access to.
Well, and one of the fun things about Prisma Health is even the geography that we have is so vast, right? The program that we do in Greenville is not the same program we do in Columbia, right? 2 hours south of us is a unique program, and that's what's fun about it, right? And we're going to go another hour south, and what's that program look like? right? And so that's what's fun is that even in my job, I have this huge geographic area that services all of the Prisma Health population, but all of them are different.
Right. And to a point, that's kind of the way it should be. And, a lot of people, the old saying goes, if you've seen one EMS program, you've seen one. That, resources and the community and the demographics always tailor, things just a little bit differently. So it's nice to hear that you guys are that adaptive. But with that, you have, your own challenges that come up where, this works in this county, but it doesn't work in 2 counties over. Why would that be? It's just, resources and things like that. So, what is like the typical community paramedic program across your jurisdiction? What do they do on a given day?
So we get referrals from the health system through Epic, and we also get referrals from some EMS systems within our own EMS system. But the typical day looks like a patient that either it's a new patient for them or a patient they've seen that's on the schedule, and they make contact via phone and say, hey, we offer this. This is a free program. This is a program at no cost to you, a program that will help you navigate the healthcare system, specifically Prisma's healthcare system. We're here to help. What problems do you see? And we'd love to come see you, right? Because I really think that in the home is where you find those social determinants of health. It's really easy for a phone call to be made after discharge. Hey, do you have all your medicine? Yep. Do you understand all your stuff? Yep. All of those things. And then you get in the home and you're like, I'm not sure you really fully comprehend your disease process or the medication changes that were made. And so the phone call of, do you want to be in the program? Because it's a voluntary program. And then show up at the house and sit down and have an initial visit, which that initial visit is what we call a domain score. It's a tool that we've kind of tailored to our own needs that addresses your social needs and your economic needs and even your healthcare literacy, right? And then start from there. Where do we need to go? What do we need to do? Do you need a little more education in your disease process? Do you need a little more help in accessing medications? Do you need help in accessing a primary care doctor? So they start at the very beginning, and it takes about an hour and a half to sit down and say, hey, I want to look at your meds. I want to look at your history. I want to understand what you understand about your disease process. And then let's make goals. Do you have goals? What are your goals? And let's work towards those goals. And then it's just knocking down walls, man. It's the paramedic doing what the paramedic does. I need to get your medication a little cheaper. Let's see if we can't get a hold of your doctor and see if we can't get some medication changes that still have efficacy, but don't cost $400 a month, right? Do we need to find resources for food? Here's the resource list I have. We have some really good resources that some of our counties have put together that are in app-based, so they're phone-based. You type in, I need food resources. It gives you a list of all the food resources. Those things exist. And sometimes it's just connecting the population to those resources. Hey, you have trouble transporting? Why don't we set up Instacart or some sort of food delivery service, right? Walmart Plus. You can sign up for it and your groceries come to your door, right? You shop from your phone and they show up. That's an option if you have that option, right? And so it's just breaking down barriers and breaking down walls and getting stuff done.
Yeah. So you said this all started about 2019 with one person. So right. How many people do you have now?
I have 18 people. 18 full-time positions that are spread amongst the footprint of Prisma. So like I said, from all the way down from Sumter, South Carolina up to Oconee.
Yeah. So is this a 24/7 service, or is this a Monday through Friday service, or how is this set up now?
So the community paramedic portion of it is a Monday through Friday, about 12-hour shift, so 7 a.m. to 7 p. The really cool thing is that we have another program that we call ETS, or our paramedics that operate within the skilled nursing facility. And that's an acute program. So that's staffed 24 hours a day, 7 days a week. So the community paramedic patients get the phone number to our communication center. And if they have an issue outside of their 12-hour shift or whatever, they always have access to a community paramedic that's on and working on the ETS side that can address the acute settings or take a message for the community paramedic for the next day.
Yeah. So obviously inside the hospital, you said through Epic or through the reporting system, you get this kind of back and forth. Does Prisma also have a 911 component in some of their counties, or are they other county-based services?
Yeah, so there are other county-based services, but we operate 911 services for Coney County. And so we get 911 referrals from our own 911 teams in Coney County.
So you have that kind of safety overlap of if somebody's not available or the community paramedic's not available, you have 911 overlap.
Yes, sir. Yep.
Okay. So how would a 911 medic or an EMT or advanced EMT who's wanting to progress up, how would they get into mobile integrated health and community paramedic?
So if you want to get into my program specifically, right, that would be 5 years of ALS experience, preferably high volume ALS experience or some sort of critical care ALS experience. And then you come to my program and we would put you through the community paramedic class that's held through the University of South Carolina School of Medicine here in Greenville. And then you have to get your IBSC certification in community paramedic within 1 year of employment to join my program.
Right. So there's a pretty clear step-by-step process. Get some years of experience, go through, get your community paramedic certification, and then go through. So how has this partnership been received by the communities that you guys are working in? Because it's relatively new, and like anything else, the first time you pick up a phone and call somebody, if they don't fully understand what it is you're providing for them, they're quick to shut you down and say, no, we're not interested or whatever, when it really could be something that could help them quite a bit.
A lot of education, a lot of community education, flyers, social media posts, the intranet through Prisma, so the internal web pages of Prisma, always having something about community paramedics up there, meeting patients in the room prior to discharge, right? So one thing we found was that when a patient gets told at 8 o'clock in the morning that today is discharge day, right? They want to go home.
Yep.
They listen to discharge instructions, I don't know, but
sometimes,
that is not the time to introduce the community paramedic program. Is the time they want to go home. So trying to get them prior to discharge, give them some flyers, say, hey, here's a program, here's an opportunity for you to stay connected to the healthcare system, educating nursing, educating physicians, educating the community as a whole that we're there. And we've had we've had a lot of success with connecting with community partners, connecting with our case managers at the healthcare system, system-wide, who are, yes, it took some time, but now are pretty comfortable with referring patients to the community paramedic program or the mobile integrated healthcare program via Epic. And I will say that there is a large supply. Right, supply is there, and demand is there, and we're we are constantly fielding referrals from case management, from community members, from EMS providers, from a number of different people.
Yeah, it kind of seems, I mean, some of the conversations I've had with others that work in this kind of area is, the initial process of laying the groundwork is always pretty difficult, to get the buy-in from the groups. But once you have the buy-in, it seems like it just kind of blossoms from there and just kind of takes off. And, I've heard stories of, people saying, well, my family member was on this program. I don't know what it's called, but I would like to be on that as well, where they visited the house. And we're like, okay, that's starting to resonate with the community when people they might not know what it's called, or they might not know exactly what the scope of it is, but they've heard enough good about it that they want to be part of it.
Yeah. And that's happened for us as well. Like as we've grown and as our name has gone out, and then, we hadn't even talked about some of the other programs that we do within mobile integrated health for Prisma. But just as kind of those tentacles go out there, people start seeing what we do and the success that we have doing it. And they say, we either want to be a part of it, or we want to be a part of it as a patient, or we want to be part of it as a healthcare team. And so Then it just continues to grow. It's blossomed tenfold for us just from the 4 years that we've started.
Yeah. Well, 4 years, and you said 18 different counties. That's a pretty significant reach for a program.
Yeah, it's been a lot of fun. It's been a lot of fun.
So, what are you guys looking at for kind of the future? We've got about 3 minutes left for this, and we're going to stick on the topic of community paramedic. But what are you guys looking at next? What's kind of like the next thing that you see as a potential great idea, or hey, this is a problem that we need to try to overcome?
Right. Well, so the biggest problem probably for most community paramedic programs or mobile integrated healthcare programs is compensation, right?
Yeah.
And so we can talk about being compensated for the work that we do. We're fortunate to be able to be compensated back through the healthcare system. But as a community paramedic, as a leader in community paramedic in the state of South Carolina, the South Carolina EMS Association is looking at how do we change legislation around being compensated for the work that we're doing, right? Whether that's alternate destinations, treat and place programs, innovative ways to approach our legislation in becoming compensated for the work we do. And we have to do that. We have to become sustainable. We have to be able to be compensated. There's a multitude of different ways that we can talk about how we're going to get compensated. But I think coming together at the state level, we meet tomorrow at the state legislation breakfast to talk about compensation ways for mobile integrated health. So the first one being compensation. The next one being as we reach out, especially in the health system world, to those who are attributed to us, right? So our healthcare system has a goal of having 1 million people covered, attributed lives with their Prisma Health, right? And so how do we incorporate community paramedic with their mission of having incorporated or attributed lives? So I think we work on compensation, but we also, the next big thing for at least Prisma Health, mobile integrated health, is going along with the journey of the healthcare system, and how do we make ourselves available to those that we serve and that are attributed to Prisma Health.
Yeah. Well, real quick, we got about a minute left. Just something that always pops into my mind. Of the counties that Prisma Health services, how many would you say of that 18 are rural counties? Because, of course, the rural areas are kind of suffering with, healthcare deserts is what a lot of people are calling them. So.
Yeah. So I would say that probably 3/4 of the counties we visit are rural, right? Greenville County being an urban one, and Richland County being urban around the cities of Greenville and the city of Columbia. The other ones are primarily rural.
Yeah. So having big impacts across the state for sure. 18 counties, that's impressive. Well, I want to thank you for taking time out of your day. I know you're super busy. It sounds like your service area is enough to keep you busy 24/7 for sure. And we'd love to have you back on to talk about the other programs underneath the mobile integrated health umbrella that you mentioned, because this is a big deal. A lot of agencies, hospital-based, rural, community-based, are looking at this to potentially help fill the needs. So it was very interesting to hear what you guys are working on.
Absolutely. Be happy to talk about any of our programs. I will talk about our team all day long.
Well, that's great. Sign of a good leader. Make sure that that you herald your teams for sure. So, well, once again, thank you, and looking forward to talking to you in the future.
Appreciate you. Thank you.